Hi, Dean again. Welcome you to the third module in our product training program, or the 13.5 week training program, or the product portion of the 13.5 week training program. Next product I'm going to train you on is one that we're really excited to train you on and get you up to speed on. It's going to be our nighttime anti-catabolic formula, or Regenabolic PM, or RPM as you see here. Regenabolic PM is crucial for getting your body into that deep, restful, recuperative sleep, or REM pattern sleep. And essentially there's three key pillars to a successful health and training regimen. Those three pillars are proper diet, the proper training program, and of course, proper sleep. And many would argue that sleep is the most important because you spend the most time throughout the day doing sleep. You almost spend a third of your life sleeping if you're getting enough sleep. That's essentially 8 hours a day. And when you sleep, your hormone production peaks, and that's when all your tissues regenerate and they rebuild, and it allows your body to heal, and that's how you get gains and prevent yourself from getting injuries as well, or overtraining. Sleep is also a portion of time where all the stored body fat is released in your system. And it's also a time where you're going to want to suppress these negative stress hormones in your body that can really degrade and cause a catabolic reaction in your body, or a muscle breaking down reaction in your body. The cycle of sleep when dreaming occurs, or restful recuperative portion of sleep, is that REM pattern, or rapid eye movement. Only with proper sleep can you reach REM or have that induced portion of REM. And REM is where you produce, or and without REM, or hitting that REM portion of sleep, you will actually produce more catabolic hormones like cortisol. And cortisol not only is a catabolic hormone, causes precious lean muscle to break down and atrophy, it also causes body fat to be stored, especially and primarily around the midsections. A lack of REM, or rapid eye movement, or restful sleep, can also inhibit the production of fat burning and muscle building HGH, and also affect the anabolic muscle building compound, or hormone, of IGF-1. It really hampers both the production of HGH and IGF-1, and again, without REM, can also cause a spike in your cortisol levels, which are all really bad things. So basically, this product can help to deal with all your sleep-related issues, and how it does that is it has a variety of great REM-inducing, hormone-balancing, hormone-optimizing products. One of the first ones is Colostrum, and essentially Colostrum is the first milking from a cow or from a mammal, and it's produced in the first 6 hours within the blood. And it's not milk, it's actually something that's produced that's nutrient-rich in immune factors and growth hormone and growth factors, and many mammals without it, without having it within the first few hours after birth, cannot survive without it. And colostrum is a great bioidentical source of HGH and IGF-1. It's got 87 growth factors, or tissue-regenerating growth factors, over 97 building immune factors in the product, like immunoglobulins, lactoferrin, as well as all these other antibiotics and antigens for treating viruses and other bacteria in the body. And again, it's going to help out with that IGF-1 and HGH production, which is diminished without the proper sleep cycles in your body. The next product next constituent in this is Mucuna, and Mucuna is a bean-like substance. It's not a bean, but it's a bean-like substance that's one of nature's richest sources of L-DOPA, and L-DOPA converts into dopamine. It's a precursor for dopamine, and dopamine is used to regulate mood, memory, cognition, sleep, motor skills, stress, motivation. It is one of the most critical neurotransmitters or chemical messengers in the brain. And a decline in its production can lead to some severe issues like mood issues, depression, anxiety disorders, and even some more severe things like Parkinson's as well. Mucuna doesn't stop your natural L-DOPA production. It actually enables extra dopamine to be stored in the body. And dopamine, circulating dopamine or increasing dopamine, actually increases circulating HGH levels. And HGH is a crucial fat-burning hormone that needs to be maximized at night. You peak in production about 2 hours into your sleep with HGH production, and you really need to maximize that production to really get what your body, or achieve what your body was trying to do during that restful sleep cycle, and trying to do as it was resetting and reacclimating its hormones in the night. The next constituent in this product is melatonin. Melatonin is a hormone that's created by serotonin by way of tryptophan. Tryptophan creates serotonin. Serotonin converts into melatonin. And melatonin regulates sleep cycle, induces REM or rapid eye movement. It's also a very powerful antioxidant in the body, and it helps to release brown adipose tissues. So it actually helps to release stored fat in your body. And REM again, melatonin again induces REM, and during that period of REM that melatonin induces, you will release that brown adipose tissue or fatty tissue that's stored around your midsection. We also have B6 in this product. B6 is a coenzyme. It's a cofactor. It plays a role in helping out with the production, secreting, or essentially catalyzing reactions in your body. It functions on over 300 bodily reactions and acts as a catalyst in this product. It also increases the circulating production of serotonin in the product, which again is great for stress relief, getting you rested, making you feel sedated and rested, and again also improving your cognitive effects and your mood as well. And if you think sleep's not important, there's over 70 million Americans dealing with sleep-related pain or issues that are caused or deteriorated, or tissues that are deteriorated in the body caused by a lack of sleep. And that's true because there's over last year there was over $4.5 billion in sleep pharmaceuticals sold. So it's becoming very, very popular throughout the medical world, and people are dealing with this, and this issue is prevalent. And without restful sleep, or the proper sleep, it's going to cause a domino effect in our health. Also, the nighttime catabolic formula is great for anybody who's not taking an anti-catabolic formula or not trying to take care of properly keep their hormones in balance at night. It's great for those who are trying to cut and maybe are trying to lose some body fat and want to preserve that precious lean muscle mass while they're cutting their calories down a little bit, especially towards the nighttime. A lot of people will start to do that at night if they're trying to drastically affect their weight loss, and the need to prevent any of that lean muscle mass that they put on, because that's going to help their metabolic rate stay active. They're going to keep their metabolic rate active and keep them burning calories efficiently. It's also going to help them from not looking depleted and kind of saggy. That's an issue when people lose a lot of weight. They look very depleted and soft looking. So it's great for those who are trying to either cut for weight loss reasons, or maybe even those who are cutting for competition, or trying to make a weight class, or just trying to make a certain event where they need to be very cut and lean for it. It's going to help to prevent any degradation of that lean muscle mass and actually increase the fat burning capabilities, or maximize the fat burning capabilities. And we really recommend using this product with any of our 2 base formulas, either the TGF or the AGF, the anabolic or the therapeutic growth factors. They work great as a combination. You can use either of those 2 products in the morning and throughout the day, or in post-workout and pre-workout as well. And again, you're going to use the RPM or the Regenabolic at night. You're going to use it 30 minutes prior to bed. It's not something that you're going to want to take in the morning to start your day with, because it will induce sleep, and it does work very quickly because it has the oral delivery, and these constituents get into your body extremely quickly with profound efficiency, and remain completely intact and bioactive during that delivery process. So you get really fast results with this product. I want to thank you for listening, and stay tuned for the post-training quiz or post-product quiz, post-training product quiz on the RPM or Regenabolic. Look forward to the next module. Thank you.